Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today's January 13th, 2023, doing a COVID-19 update. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So 6,092 cases of COVID. This is only PCR, like I've said in the previous ones. PCR meaning that these are not home tests, nor they are rapid antigens that were popular back in the a year or two ago. This is solely just PCR. That's the only ones we get. Home kits are not contact trace. They don't make the system. However, if you get a heavy case of PCRs, then you're getting a heavier case of, but some multiplier higher of actual cases because most people are going to the home tests. So over the 2 weeks, from the 15th to the 29th, so the end of December, actually I should fix that. I didn't fix that one. That is the last 2 weeks. Up until Thursday, sorry. So I did not change that, but that would be the last 2 weeks, basically the beginning of the year. 105 confirmed PCR cases. So we're averaging a little over 50. We're a little bit higher. We went up a little bit. I'll show you what, January is usually our month to be high. Last 4 weeks, we're averaging about 50. Our incidence rate's 23.7, which is up 2.8, and our positivity is 12.89, which went up about almost 4.5%. We are in the medium category. Our cases are fewer than 200 per 100,000. This is the county. Our new COVID admissions per 100,000 is 19.2, which is slightly, so we're in the high medium. Last week we were in the low high. So we actually came down, the county came down a little bit. And 7.4% of the beds used. So we fall into that yellow medium category. This is through the 12th of January. But I like this chart to show you. So this is hospitalization charts, and you can see that we had two peaks. This is from the beginning, far left being the beginning, more recent at the end. That first bump was Delta, which rivaled Omicron for hospitalizations, even though if you had overlaid actual cases, the cases would have been much higher in the 2022 spike. It just shows you that the two times that we've had spikes, January 21, January 22, and on the far right, you see January 23, which has got a bump, but not a spike. So I think that's what we've seen. January is probably going to be our month, and it's the cold and flu as well month, respiratory viruses coming out of the holidays, lots of mixing, lots of travel, lots of this, that, and the other stuff, people getting together that don't normally get together. And you get an increase, but you don't see an increase like you saw in last January. The number of cases were off the chart. And nor did you see even the number of hospitalizations, which was high relative to the number of cases, but it was a spike nonetheless in January of 21. So January is the month that we seem to get the highest amount of cases. We're on the high side for incidence rate. See, Falmouth is up. We're not the highest, but we're on the high side for that. And somewhere, looks like in the middle for positivity. There's been, there's a fair amount of COVID out there, like there's always been, and it's going to be worse in the winter, and January to be the worst month. That's pretty much been the MO. Just under 10,000 cases in the state for that time period of, I think it's 2 weeks now, time period. That the trends show you that hospitalizations is up, but sort of flattening maybe a little. Deaths are up a little bit, but not high. You start seeing the positivity coming down a little bit, and you see the cases actually starting to dip a little bit. So it really seems like, and then when you get into this is the charts from the MWRA wastewater system, so it's tracking virus in the wastewater. You can see that sort of up that you see here, and then you see that flattening out, but you also see it in the wastewater. All right, so you see that, this is our January spike. Look at the one you had on the far left. It was off the chart. That was Omicron of last year. So the viral DNA was somewhere way off the chart load on the MWA sewer system, both in the northern region and the south. The southern's in brown, the north's in green. And you see that it's come, it went way down in the spring of last year, and then it's sort of been meandering with a bit of an uptick, but nothing like we would have seen in the previous two Januaries. So that's the good part. It just means that, it's here to stay, and January is going to be the worst month, and that's the trend. So that's it for cases. So there's, a fair amount of COVID out there. There has been. And like I said, coming out of the holiday season, that's generally where we see the biggest spike. Just nothing like we saw in the last previous 2 years. Boosters, recommending boosters. Again, 5 years and older, updated bivalent dose. If you're getting vaccinated for the first time, you're still going to do monovalent, so you're going to get the original version. So The boosters are going to be bivalent. The initial series, the 21, 28 days apart, well, remember a couple of years ago, will still be the monovalent. Plenty of vaccine around. Just go on vaxfinder.mass.gov. It's there. People with children under 3 should see their pediatrician, but there are appointments. Just go on vaxfinder.mass.gov, and there'll be some there. Just need to schedule it. Looking at vaccination rates, again, this is the state numbers. I counted 284 doses total of the different kinds. You see that we have a high vaccination rate, but you can see it tapering off. So the number's not perfect. I don't think we had 30,000 out of the 32,000 actually get vaccinated with their first dose. I think it's a high. Some of those probably belong in the boosters, but not to the, but that aside, you see that we have a high vaccination rate, but quite a bit of a drop off to boosters. So it looks like a third of the people roughly didn't get a booster, and about 70% of us who have gotten at least their primary series have not gotten a booster. So, hospitalizations will tick up, and when we see some of the cases, we do see the PCR cases and so forth. A lot of it, a fair amount of it's been people that have gotten the original series, but that's been going on 2 years now. So you got it most people got their first series somewhere spring of 21. We're heading, a month or two, we're almost into, we'll be into the spring of 23. So it's been a little under 2 years, and there's a fair amount of people who have not gotten any shots, any vaccinations after that, and perhaps the waning of the initial series, and not getting into the second boosters, and of course, Omicron has switched and morphed. Luckily not to like it did at Delta with the lower respiratory severity, seen much more frequently in Delta. That, I think maybe that's part of the reason why the cases are up. It's the time of year, like I said before, but also this has probably got a factor to do too, is the sort of lack of uptake when you get into the second booster time. So the state has us down as 10,002 second booster doses, which is 31% of the population. So it's a little bit low. As far as what's there for variants, this was very fluid up until around the holidays, but that XBB.1.5 is taken over about as fast as I've seen any of the different variants. That's one's really, the XBB is definitely taken over around here. That is the primary one. So if you've gotten COVID back, let's say in October, you probably got BA5, and now any exposure will be XBB. Now, if you got vax boosted and you've gotten this bivalent booster, or you've had it recently, you'll probably, you'll probably do fairly well because they are still related, but it's just another variant, and this will just keep waving around, and that's kind of what it's been doing. Different variants here and there. They're all sort of Omicron based, so that's what it is. So, as a recap, the counties medium, they were high last week. Most were high last week, and we're at the high medium, so to speak. There is vaccine, there's tests, there's home tests. We just got an order of some home tests that we'll be distributing through the senior center, the service center, a few here at Town Hall. We'll look around and get distributed, and whenever the state says you can want some, we will take some and we'll get rid of them. So the XBB is 0.1, 0.5 is your dominant strain. There's boosters around if you want a booster. There are no mandates. Still have this, the select board still has a advisory in town-owned buildings for mask wearing, but there are no mandates. There has been some on the news that some schools started with that up around Boston. But there is nothing here for any mandates. I don't see us going mandates. And so that's what I have for a recap. Again, there's going to be a fair amount of COVID here, especially in the winter, especially in January. And I guess the other recap would be, the uptake of the bivalent boosters is probably less than what I would think, considering the amount of uptake we had for our original series. So that's what I have for a recap, and we'll do this again in 2 weeks. Thanks.